We're back with the White House Chief of Staff, Rahm Emanuel. You are deeply involved in the health care negotiations on Capitol Hill. Right now, behind closed doors in the Senate. This is a story from the Washington Post today. Small group now leads closed-door negotiations. And it quotes the president from candidate Obama saying, "We will have these discussions televised on C-SPAN. Everyone will be at the table. We'll do this in an open and transparent way." Why does it have to be done behind closed doors?
Oh, John, first of all, I mean, you know very well that this has been, the entire healthcare process has been fully public. In the
this
sense
is the
of
most important part.
Yeah, and everybody's been is going to continue to be involved. We went up to have the first set of a series of discussions. You saw all the hearings. Many people said, you know, covered the hearings in 5 separate committees that had those discussions. There were discussions happening then, both at the hearing level and also
as you negotiate now,
as you negotiate in private. But that doesn't mean that you can't have what's going on. The key point in this debate about health care, John, isn't what's going on in the sense of just these negotiations. Those are key. Is what, in the end of the day, will the result achieve what I call the 4 C's? That is, are we going to control costs, expand coverage, give people choice, and competition in the system? And that's the goal the president set out. We went up there. You had 2 committee chairmen as well as the Senate Majority Leader there. Everybody knows the issues that we were discussing.
You have another stop, so I want to interrupt you because you have another stop to make, and my time is limited. In the C's, controlling costs.
I was actually getting close to being a senator.
You were filibustering quite well. You're getting good at it. One of the controlling cost elements here is competition. Here is, would you have the public option? And on the Senate side, you know, it's harder to sell in the Senate because you have more centrists involved. Is this an acceptable public option to Rahm Emanuel? The Olympia Snow trigger plan, maybe with a combination of Tom Carper's proposal to let the states do it.
Breaking news, John. It doesn't matter whether it's acceptable.
It does matter whether it's acceptable to you because you'll have to sell it on the House side.
No, here's the deal. As you saw, the president said in the joint session to Congress, he believed a public option is important to competition because in many parts of the country, a single health insurance industry has 80%, 70% of the market. Let me go finish. It is also parts of that parts of the country where premiums are the highest. So if you don't have competition, an insurance company has the run of not only premiums, what type of health care you have. And so the president believes in it as a source of competition. He also believes that it's not the defining piece of health care. It is whether we achieve both cost control, coverage, as well as the choice that is essential.
Trigger good enough for the president?
The president of the United States will obviously weigh in when it's important to weigh in on that. There are key members of the Senate that want a public option. The Senator Snow, who's also important, would like to see a trigger. But what is implicit in the notion of a trigger is that you should always have available that option of having a public plan to bring the type of competition that brings downward pressure on prices and price effect of health care costs.
The way the Senate Finance Committee bill is paid for is a fee on these Cadillac insurance plans. And your friends in the labor movement say, no way. That what happens is you'll put the fee on the insurance companies and they will backdoor that by passing the costs on to the consumers. Jerry McEntee, the president of the American Federation of State, County, Municipal Employees, says, we all worked for these people. We worked for Obama. What do we get for it? We not only don't get anything for it, we get a slap in the face. They say that that's a backdoor way of violating the president's promise not to raise taxes on the middle class. Will that be in the final bill?
First, one of the first things the president did when he got into office was ensure the largest middle-class tax cut in history, because middle class had basically saw their incomes.
So why does the labor leader call it a slap in the face?
Well, that's his position. In fact, the president spoke to this in the joint session. But I want to go back. Remember this: the middle class received one of the largest tax cuts, and one of the first things he'd done in the first 45 days of his office. Second, this is basically one of the ways in which you basically put downward pressure on health care costs. The president believes, as he said in the joint session, that while he opposed this originally, thinks that and based on the analysis, it is helpful in getting costs under control. And it hits the insurance companies and the high expansive and expensive plans.
We have a $1.4 trillion deficit this year. I know the president has said he will cut it in half in his first term. Healthcare reform will be deficit neutral is the president's position, and yet,
more than deficit, John, wait a second. More than deficit neutral.
Okay, you say we'll help bring the deficit down.
That's what the Senate finance. And also, let me make a point up here, which I think I really want to make this point. When the prescription drug bill was passed in the 80s, I mean, rather in 2005.
In the Bush administration.
Yes, in the Bush administration. There was no pay for it. It was charged on the credit card. And it run up costs as far as I could see, basically for about $850 billion. This bill, somewhere will be about $850, $900 billion, fully paid for, done within the healthcare system, and it brings down the deficit. And it's the first step if you want to control.
Except
as you know,
the administration has asked the Senate
to do this
$250 billion Medicare fix to doctors. The administration has asked the Senate to do that outside of healthcare reform, and right now there is no way to pay for it.
Yeah, but John, in fact, is the president's, these are one of the gimmicks that was done year after year in Washington.
So why do it now? If it's been done year after year, why not end it?
And the president's budget, in fact, included it in his budget when we negotiated that and we passed the budget. The first year is paid for. What happens is everybody says, don't worry about it, and then they just pass it on. We've made a difference, but the first piece of controlling the deficit is health care. I will also say the next step is also important, is pay as you go. In the 2000 era, starting in 2001, the discipline of the 90s that led to a surplus was pay as you go. That was eliminated, basically allowed to lapse. And we passed 3 tax cuts, a prescription drug bill that led to $5 trillion of red ink run-up, the biggest red ink run-up in the shortest period of time in American history. Literally over half the nation's debt is accumulated in the last 8 years.
I traveled 40 states in the last 40 weeks, and people often use language for which you and I are known for using, mostly in private, not often in public, when they come to the issue
I didn't know you were a fellow traveler, John.
They're watching Wall Street, and they see the stock market going up, and many of them think that's a good thing, but they also see 9, 10%, if you go to Michigan, 15% unemployment, and they see this past week, Citigroup gets $45 billion in government bailout money, pays $5.3 billion in bonuses. Bank of America gets $45 billion in their taxpayer money, pays out $3.3 billion in bonus. Is there anything the president can do about this?
Well, and the level is, and one of the issues is, I think the American people have a right to be frustrated and angry. In this sense, when the financial markets and the financial system had frozen up to a point that literally, one of the reasons the economy was literally going towards a depression, literally head first. There was a 1 out of 3 chance we were going to get a depression. That basically the system came, and the only people, the only place that you could actually resolve this situation was the government, which required the taxpayers putting up $700 billion. That as soon as stability was achieved and things had a sense of normalcy, what do some of the titans in the financial industry do? Is they're literally going and fighting the very type of regulations and reforms that are necessary to prevent, again, a crisis like this happening. And as somebody who has literally sat once and was in Congressman Barney Frank's committee, the Financial Services Committee, that they're literally in that short of order. They assume everybody else has, basically short-term memory problems around here. The notion that they came, and and the president understands things, why he's spoken to this, why the American people are frustrated. Not only do they come for a bailout, that in this short period of time where they have a level of normalcy because of what the government did to help them, they're now back trying to fight consumer offices and the type of protections that will prevent another type of situation where the economy is taken over the cliff by the actions taken on Wall Street and the financial market. And that is what's frustrating people. What's also frustrating to the American people, and the part on the bonuses, I understand, as a former member of Congress representing people, is that while they see these bonuses going back, and they see that as part of what the banks pay, is in fact there was an article the other day in the USA Today, incomes are at their 18-year low. So while they're struggling to try to make ends meet, save for their retirement, pay for health care costs that are going up 10% next year according to the Hewitt Associates, provide for their children to education, while they're struggling to make ends meet, Wall Street is back doing what Wall Street did. They have a responsibility to the whole system, and it starts with not fighting the financial regulatory system and the reforms that are necessary to protect consumers, homeowners, and others. They have a responsibility to come to the table and understand that the risks that they took the economy to a place it was near a depression, which we hadn't seen since literally the 30s. They have a responsibility, part of the solution, not part of being the obstacle and the forces, which is what this president is facing both on health care and the financial system. Is fighting the very special interests that have a vested interest in keeping the status quo, and their friends up on Capitol Hill who have actually been their advocates of keeping the status quo.